My name is Krista Arganchona, and I'm the Program Manager for Special Pathogens at Providence Sacred Heart Medical Center. I'm joined today by Stephen Hopkins, who is the educator for our intensive care unit and our special pathogens unit. As we continue our response to this COVID pandemic, and we anticipate the influenza season upon us with fall and winter coming, we wanted to provide a refresher training for you for donning and doffing two different specific PPE ensembles for COVID, go over some conservation and disinfection techniques of PPE so that you can continue to provide safe care, keep yourselves safe, and also be good stewards of the PPE that we have.
First, we're going to demonstrate the COVID PPE ensemble for special droplet contact precautions with an N95 mask and face shield for aerosolizing procedures. We're going to demonstrate this with a single glove, but a double glove technique is appropriate. Krista's going to start with performing hand hygiene. She's then going to secure her hair. Most people choose to do this with some sort of a cloth covering. The key point here is we don't want anybody's hair getting into their face where they feel like they want to reach up and touch their face. So that's the most important part of this. If it's not appropriate for your hair, it's not a necessary step. Then she's going to don her gown. It's important to tie the gown to maintain safety. Krista's then going to don her N95 respirator protection.
When you don an N95 mask, if you're using this particular halyard brand, you want to make sure and separate the bands, secure it under your chin, and extend the first band behind your head under your ears, and then put the other one on top of your ears, and then secure the fit on your nose.
Krista's then going to place her face shield. And finally, Krista's going to don her gloves. Make sure the cuff of your glove extends beyond the cuff of your gown. And now she's ready to enter the patient room. Now Krista's getting ready to doff her PPE ensemble. So the setting is we are in the patient room. She has just finished care with the patient. She's going to come to the door. She's going to perform hand hygiene. Next, she's going to doff her gown and gloves. She's going to break the tie or untie it at the waist. And notice, be mindful that she leans forward and lets the gown fall so she can roll the ball up so that the outside of the gown gets contained on the inside and dispose of in the trash can. Krista will perform hand hygiene and then she'll exit the room. So the setting now is Krista will have exited the patient room. She will proceed to the designated area for taking off her face shield and her respiratory protection. She's going to go ahead and start by donning a new set of gloves because she is going to be handling disinfectant wipes. You can put one wipe down to place the face shield on, just as she did there. She's going to take another wipe. She's going to disinfect the face shield. Now that's been wiped down and it'll be there for its disinfecting contact time. She's going to doff her N95 mask. So she's going to do that by pinching the bottom strap first and bringing that up over her head, and then moving the top strap. And this helps prevent that N95 from falling down into contact with the caregiver. And dispose of that, whatever is appropriate at your facility. We may be recycling those in the bins or they may be disposed of. So please refer to wherever you work. And she'll perform hand hygiene again. We demonstrated the donning and doffing process for special droplet contact precautions with an N95 mask, but with a droplet mask, we would do the same process. But when doffing the droplet mask, Krista wants to make sure to reach back and only touching the ear loops, leaning forward so that the mask is not coming into contact. As you're doing your donning and doffing, be consistent and go slow. It's the most important thing we can do to help keep ourselves safe.
Now we're going to demonstrate the donning and doffing of a PPE ensemble with the MAXAIR CAPR. We're also going to utilize the two glove method for this. In our last demonstration, we utilized the one glove method, and this time we're going to do the two glove. And really the rationale behind using the second pair of gloves is so that you have that pair of gloves on when you go to disinfect your CAPR, and you don't have to hand sanitize, wait for your hands to dry, and then don a second pair of gloves. So that's the rationale behind why we use the two glove method. Both methods are fine to use with both ensembles of PPE. So we're going to start as Stephen is going to perform hand hygiene. Now he's going to don his belt and then attach the battery to the belt. You're also welcome to put the battery in the pocket of your scrubs if that's preferable for you. Either way is fine. Now he's going to get his CAPR ready. He's going to put his comfort strip in his CAPR. And we assign a comfort strip at our facility for each caregiver and then write their names on it and store it in their unit so we can conserve that. Next, he's going to take his lens cuff and he's going to apply it on the sides, in the front, and then on the other side. Then at this point, he's going to remove the film off of the outside of the lens cuff. And then he's going to flip it over and he's going to loosen the plastic tabs on either side of the lens cuff. And then this just loosens that plastic film so it's easier to tuck under your chin when you don it. Okay, now he's going to proceed with plugging the CAPR into the battery pack. And when you plug the CAPR in, you want to make sure that all 5 lights turn on. There should be 3 green lights, 1 red light, and 1 yellow light. The red and the yellow light should turn off after a few seconds, and the green lights indicate your battery life. Next, Stephen is going to don the CAPR. First, he's going to doff his face mask. Then he's going to grab that CAPR by the knob, loosen it, and then put it on his head and adjust to get a good snug fit. And then he'll extend that film underneath his chin. Okay, next Stephen's going to don his first pair of gloves. And then he's going to don his gown. And we're demonstrating the process of donning the CAPR first and then the gown. Some facilities, people don the gown first and then snake the cord of the CAPR down through the gown before they tie it. Either way is fine. Please use the process that has been successful for you and your facility. And as we discussed before, we're going to make sure and secure all ties on the gown, tying them in a bow to make that doffing process easier. And then he's going to finish by putting his second pair of gloves on over the cuff of the gown. And then he's ready to go into the patient room. All right, now we're going to go through the doffing process. So Stephen is in the patient room right now. He's going to begin by performing hands hygiene. And then he's going to doff his gown and his external gloves in one motion. You can also doff your external gloves first and then the gown, whichever part is more comfortable for you. But you're going to doff that gown in a nice, slow, methodical fashion as we did before, rolling it up into a small ball and gently placing it in the garbage can. And then he's going to perform hand hygiene. And then he will exit the room. Once he's out into the hallway, you want to have some sort of a surface to be able to doff your CAPR onto. So he's going to first take a disinfectant wipe out and set it out on the surface. And then he's going to remove his CAPR by loosening the knob on the back of his head, lifting it off, and setting it down on the surface to disinfect. I'm going to disconnect the battery from your battery pack. And at this point, if you're going to be continuing to reuse your CAPR throughout the rest of your shift, you want to make sure and disinfect the lens cuff while it's attached to the CAPR. And then you can store your CAPR in a plastic bag back in the CAPR cart or whatever designated area you have. If this is the end of your shift, you would remove the lens cuff from the CAPR. And if you're practicing reuse technique of your lens cuff, you would store it in the designated space on your unit. And then he's going to remove the comfort strip and store that where the lens cuff is stored. He's going to put the CAPR back where it goes. Next, he's going to remove his belt and battery and disinfect those with a disinfectant wipe and place them back in the CAPR cart or the designated storage area. Then he's going to perform hand hygiene and doff those gloves and gently discard them. And then he'll finish with hand hygiene. As with our other donning and doffing PPE ensemble, we just want to emphasize the importance of consistently and slowly going through the process to make sure that you're maintaining safety for yourself. All right, now we're going to talk through some decontamination and conservation techniques for different pieces of PPE, as we are all been practicing reuse of a lot of products. So first, let's start with our N95 mask. As we demonstrated earlier in the video of how to doff it, once you get it doffed and off, you want to make sure and not touch any part of the front part of the mask, and have a brown paper bag and just gently place it in the bag. You don't want to place an N95 for storage in a sealed bag, but in a dry paper bag. So you just have your name on it, and then you can use this throughout the rest of your shift. We did not demonstrate goggles, so if there are caregivers that are wearing goggles instead of a face shield, we want to demonstrate the process in doffing them and disinfecting them. So you just set them off on a surface, get a disinfectant wipe, whatever disinfectant wipes are being provided for your facility, and make sure and just decontaminate all surfaces and allow them to have their contact time to dry. And then you can store those with the rest of your other PPE items that you're going to be reusing. So remember, since your N95 is stored in the paper bag in here, you do not want to seal your Ziploc bag. Keep it open at the top. Now we're going to talk about our lens cuff and our comfort strips. As Stephen demonstrated in our donning and doffing demonstration with the CAPR, we have been reusing these lens cuffs, and many caregivers have found that we can disinfect them, the front and the others, both sides, and successfully use them over. We store them in a 2-gallon Ziploc as well, and then the designated comfort strip for that caregiver can be stored in there as well. As we continue to navigate this pandemic, we want to encourage caregivers to implement these conservation strategies that are simple things we can do to maintain safety and to be good stewards of the PPE that we have. Now we want to talk about how you may be seeing different pieces of PPE as we continue to face some supply chain challenges throughout this pandemic. For example, you may see some gowns that are yellow or white or blue. There's several different types of goggles that are available through the supply chain. And then there's multiple different types of face shields that you can use. We want caregivers to be reassured that we have an established process between our supply chain department and our infection prevention department, so that any piece of PPE that we receive, infection prevention evaluates to make sure it meets those safety standards for our healthcare workers. So if you have a new piece of PPE show up on your unit that you haven't seen before, you can be reassured that it meets the safety standards for you to use. We hope this refresher has been helpful because we care about your safety. As we continue through this pandemic response, many of us have been donning and doffing PPE more now in our career than we have in the past, and it's easy to become complacent. So we wanted to emphasize the importance of going slowly and establishing a consistent and methodical process for your donning and doffing techniques. Thank you for your attention, and be safe.